So good afternoon, ladies and gentlemen. It's 2 o'clock, and so we are going to open our Mental Health Board meeting for the month of March. First, we're going to have our roll call. Mariana Body, Andrell Bragg-Shaw, Dr. Copeland, Dr. Giardini, Dr. Gorski, Tim Neighbors, Jeff Nielsen, Dr. Penny, Mohammed Yunus, Richard Kunnert here, Jason Holcomb, our director, and our staff from Region 1 Planning. And this is Brandy Quantz, our attorney from ZRFM Law. The second order of business is public comments. And this afternoon, we have 3 people who would like to present. And first is Dr. Stagnaro Green.
Well, thank you, and I will abide by my 3 minutes to see everybody again. So I'm Alex Stagnaro Green, the Regional Dean of the U of I College of Medicine, Rockford. I would also like to recognize our colleagues in the audience who are part of SWAT from Rockford University and UIUC. 16 months ago, the Winnebago County Community Mental Health Board awarded a consortium of 4 institutions a $2 million grant. Our goal was simple: to create a pipeline of social workers for the shortage of mental health workers in Winnebago County. This shortage was identified as a major limitation in providing the mental health care services needed by our community. To accomplish this goal, Rockford University, Rock Valley College, the University of Illinois Urbana-Champaign School of Social Work, and the University of Illinois College of Medicine, Rockford combined forces. And although not formally part of SWAT or funded by this group, RPS became a team. The challenge was daunting. Rockford did not have any social work programs. Rock Valley College needed to create an Associate of Arts degree in Human Services. Rockford University had to develop a degree, a Bachelor's of Social Work. UIUC needed to recruit and embrace Winnebago students in their existing online MSW and BSW programs. And the College of Medicine had to agree to serve as the catalyst and matchmaker. In the ensuing SWAT 1 has accomplished all of its objectives. RU has surpassed the expectations for accreditation for the first year of the 3-year accreditation cycle. 10 students are enrolled in their first cohort, and currently 7 of those 10 are working as interns in our community. Rock Valley College will be offering an associate degree in human services this fall, as well as a certificate of human services and a certificate in domestic violence. Enrolled in Rock Valley College and SWAT, and another 8 planned for the fall. 17 students at UIUC are currently enrolled in the online MSW and BSW program, and UIUC has developed strong relationships with our community here in Rockford. Our medical school is utilizing its resources in HR, finance, public affairs, and the dean's office to coordinate SWAT. In total, 29 students are presently enrolled, and another 8 will be enrolled come the fall, getting to our initial goal of 40 students in cohort 1. On top of this, RPS 205, as a collaborating partner for SWAT, has 80 students participating in their programs. We come to you today to request funding for what we're calling cohort 2, which would begin in the fall to support additional 27 students at RU and the need for social workers in Winnebago County remains strong. SWAT has proven its effectiveness. We are therefore requesting $1.5 million for SWAT Take 2, an opportunity to train the next generation of social workers for Winnebago County. Thank you.
Thank you, Doctor. Oh. The second would be Sadie Cobio.
Thank you for having me. My name is Sadie Cobio. I serve as the Regional Director of Northern Illinois for Rosecrans Behavioral Health, for those of you who I haven't had the opportunity to meet. I'm here today to talk to you guys a little bit about our Medication Assisted Recovery Program. Some folks also call it MAT or Medication a little bit interchangeable there. We welcome Dr. Graywall to Rosecrans Ware Center off of North Main. She is a board certified family medicine physician who specialized in addiction medicine, currently serving those over the age of 18 and for a broad spectrum of substances such as opioids, alcohol, stimulants, or nicotine. We give medications like Suboxone, buprenorphine, naltrexone, Campril, and Subutex. I am not in medical, as well as injections for Sublocade and Vivitrol. I just wanted to share that this is a service we have. We are obviously funded by the Mental Health Board and do a lot for the mental health arm, but serving those kind of collaboratively, this is a service that is offered to our clients who may be in just that mental health arm in the event they need MAR services. Individuals can walk into the Rosecrans Ware Center off of North Main for an assessment or at any point in their treatment if they're already enrolled. Thank you so much.
Thank you. And our third speaker is Karen Hill.
Hi, my name's Karen Hill. I came before this group about a year ago and gave you some numbers. I am an assistant coordinator for the overnight cafe by Second First Church at Church in Jefferson. And we have wrapped up our season for this year. Sunday was our last day. We served a total of 379 guests. 303 of them were males, 72 females, and 2 were other, listed themselves as other. We have more data. We just haven't gotten it collected yet in regards to where do these folks come from? Are they veterans? Are they disabilities, et cetera? In talking to many of the guests on Sunday night, learned they either have been able to get on waiting list for housing or have been given resources in regards to where they might be able to find housing. We had the support of St. Vincent de Paul and 7 churches from our community that assisted with meals, and some also contributed financially. A couple of our staff are also on staff at Rosecrans and able to connect with clients they may have met or were needing to meet. So that was very positive. 2 of our staff this year were actually 2 guests of our services last year, and were great additions to our staff. We had an anomaly this year in that we opened on a Saturday, like day, not 7 p.m. to 6 p.m. to 7 a.m. as usual, but there was a Saturday that the weather was very, very cold, and we were able to recruit volunteers from our church, from the Homeless Coalition. Andrell was able to join us. Marie from the city was able to join us as a couple of them. And we managed to get through the day. And there was a question of like, well, what about Sunday? Because nothing is open on Sunday. And we're like, we made it through Saturday and we're good. And on Sunday morning, it was the last Sunday of the month. A church hosts a waffles and worship time. And at 7 a.m., our guests got up, packed up their stuff, and transitioned over to Court Street for the morning. And then we opened again at 5 that afternoon to get them out of the elements. So we are considering a really good year for our program. We closed on Sunday in regards to it's a funding issue, and also our staff were tapped out. So we have our wrap-up meeting next week and start planning for how we want to make adjustments for next season. So thank you very much.
Thank you. Thanks for being here. And also thank you, please, to all the members of your church for what it is that they're doing. Before we get into the rest of the schedule, I was also asked to remind you of like to set their calendars early. This May 14th, Building Bridges, that NAMI Northern Illinois is presenting. So there'll be a speaker, Norma McInerney, and there'll be a whole panel for that day. So if you want, please put that on your calendar for Thursday evening. Okay. We have no presentations for today, but next is our monthly activity report. Jason.
Just highlighting a few things. We've been really doing a lot of coordinating work with many of the network groups that are working on mental health related issues or adjacent to mental health related issues. I had mentioned last month that the Miami workshop attendance list has been confirmed and the registration has gone out for that for those that are attending. So we are excited to keep moving that forward. And looking ahead for March, April, and May, you probably saw we have a lot of site visits scheduled. So please make sure to look at that list and cross-reference it with your calendar and let Alex know which of those sites that are able to attend. And look forward to getting through that next round of site visits.
Okay. Thank you, Jason. So then our next piece of business is our minutes for February. So if I can have a motion, okay, Tim, a second, okay, Jeff, okay. So those in favor of accepting the report as given, say aye. Anyone opposed? Modified? Okay, hearing none, it's passed. Then we move to our first action, and that's in authorizing program budget updates for two of our programs. One, City of Rockford, and the second was Northern Illinois. And board members, you've seen this, and it was sent to you. So I'm going to then go through the roll call to see whether or not you approve of these two programs. So,
Get a motion first.
I'm sorry, Tim. Okay, you need a motion. Thank you. You did that. Okay, Andrew, seconded. Thank you. Okay. All right. So then our vote, pardon me? Okay, I'm sorry. We okay.
I can, so and we have representatives from both of the organizations if you have more detailed questions, but essentially the crisis corresponder team is looking for a little bit more flexibility and emergency placement for individuals that need emergency placement when they've been identified through their outreach efforts, like an overnight hotel or something like that. And they're finding that the HUD-funded programs has created challenges to getting that immediately for them. And so they're just moving where they've had a little bit of flexibility in their budget to provide for that availability, and that's for $5,000 shifting of line items. Sergeant Mays, please correct me if I'm missing anything on that. Okay, and then we have the second one was for NAMI, and the national speakers, cost of national speakers, so it was previously budgeted for the Building Bridges event. They were not able to identify a national speaker for that original budget price, so they're shifting where they had some underspending to accommodate for the higher cost of speakers.
All set? Okay. Okay, then Bragg, Shaw? Okay. Dr. Copeland? Dr. Giardini?
Yes.
Dr. Gorski? Tim Neighbors? Jeff Nielsen? Okay. Richard Quinert? Yes. Okay. All right. Then our second resolution is the big one for today, which is the funding for the grant funds for grassroots funding applications. Excuse me, just one moment. So for the resolution, number 2026 XX, authorizing the Winnebago County Mental Health Board funding and allocation of grant funds for grassroots funding applications. And whereas the Winnebago County Mental Health Board is a community health board operating pursuant to the Mental Health Act 40520. And whereas Winnebago County Mental Health Board published a 3-year strategic plan defining priorities and target populations, a grassroots program funding notice of funding opportunity, requesting letters of interest for proposals from small community-based organizations that serve an identified target population and align with one of the community support components. That is of mental health treatment, case management, family and community support, and client identification. And whereas we've had these letters of interest in meeting the criteria, we're asked to participate in the process and participate in the application project with modifications. And whereas the Community Mental Health Board received 10 applications requesting funding totaling $1,798,283. Awards that can be made not to exceed $2 million in total awarded funding. And whereas the Community Mental Health Board members reviewed, evaluated, and scored the 10 applications according to established scoring rubrics that were published alongside the Notice of Funding Opportunity, and developed decisions for these organizations and programs. So now, therefore, be it resolved by the President and the Board of the Winnebago County Community Mental Health Board of Winnebago County, Illinois, as follows. The Community Mental Health Board shall fund the following applications contingent upon the execution of funding agreements and work plans. The Tommy Corral Memorial Foundation is $100,000 for training to treatment and strengthening mental health pathways. Rockford Area Arts Council has been awarded $200,000 to fund the Spark program at Washington Park. The Northwest Community Center has been awarded $199,914 for their county program. St. Peter and Paul Roman Catholic Church has been awarded $200,000 for the Emmaus Mental Health Program. Zion West Enterprise has been awarded $200,000 for their Project Mentality Unchanged. The Comprehensive Community Solution has been awarded $200,000 for their Alive and Free program. St. Vincent de Paul Society of the Rockford Council has been awarded $200,000 for their Compassionate Assistance for Recovery, Empowerment, and Stability. And then finally, the Second Congregational First Presbyterian Church has funded $7,000 for their overnight cafe. And then, I'm sorry, there's one more. Live for Lolly, and they have been awarded $151,368, $151,368 for their project backpack. Winnebago shall not fund the following application for funding, and that's the Kick First Entrepreneurial Academy. So with that, I'm going to be asking for a vote for approval of the, I need a motion first. Okay, Jeff, thank you. Second. So there's been a move to accept the recommendations that have been put forward by the board for funding the grassroots program. Andrell Bradshaw, Dr. Copeland, Dr. Giardini.
Before I vote, I don't know if this is out of protocol, so I'm gonna say it anyways. I reject ChatGPT is not an answer to these proposals. When it was written, as it was written, you could tell right away that this is not sincere. I refuse to accept insincere proposals. Only 3 I accept. 3 of them, some of them actually were done by hand. So I just want this here that I'm rejecting 7 of them. But if my colleagues accept them, then I will go with my colleagues. But I can tell you that I rejected 7 of them. I will make that very clear. Okay? Now, with that, I will go with my colleagues. If they all said yes, even though I don't always fully agree, yes, I might.
Okay. Okay. I'm free.
No, we did not have that, and that's something based on board member feedback that I think for future grant applications, we should discuss at the front of the process so that if there's an expectation of standards around using AI, that we make that clear for future funding. That's something we have, and obviously we're dealing with a changing world in real time, and what we were seeing in 2020 when we started is not the same that we're seeing today in 2026.
I have to join your group.
It's called Article Line. But may I continue? And with that said, you're right, if that's going to be ChatGPT, you won't need us. And we won't need you. Because what's going to happen is you're going to go, here's going to be the therapist. In language, the voice you want to hear, you'll tell you this right here, and that's it. Okay? I know that in trouble you and I talked about this, and you rejected, I know you and I said it, because there's something about face to face. You know, these are part of the bond. We're used to talking to people. We're used to sitting down face to face with you. And that's all we ask of you. Do it face to face. You know, the true nature of your group. This one here too. No matter what.
Okay. Thank you. Dr. Gorski? Okay. Tim Neighbors? Jeff Nielsen? Okay. Dr. Perry, no. Richard Quinert, yes. Okay, no,
Oh.
yeah, okay, all right, okay, thank you for that. So, and we will need to have that discussion. Okay. The agenda is to look at the annual report. And you have a draft of this that was sent out to you, and there's a timeline for Alex.
Feedback for the annual report, I can send it back to Jason by Monday. And yeah, I already had one feedback already, so just give me feedback before the end of the day on Monday.
Okay. Yeah.
We have the new metrics in terms of domains in the outcomes. So that's similar to kind of some of the trends that people have been interested in highlighting or understanding what progress has been made. So it also links to the dashboard as well. So that was an expansion that we added this year to have that in to complement the previous normal metrics we have in the report.
Okay. And then finally, point under discussion items is the strategic plan for our environmental scan and goal. Jason, you want to speak to this?
Yeah, I'm gonna share the screen and then Alex and I will present this.
The hand.
Okay, that should work. Make sure the slides are moving. There we go. All right. Well, it's that time again that we're required to do the strategic plan every 3 years per the state statute. Believe it or not, this is now the third iteration. So we're looking at strategic plan 3.0, and we have followed mostly the same process that we've done in the past with the environmental scan survey, which goes out to the funded, to the direct service providers. We're going to mostly focus on that today in the area of programming. The other two components from the past years have been the systems coordination. And this year for that particular area, we also did key informant interviews for a number of the service providers, particularly representing the different areas that were outlined in the consultant report from Guidehouse, and really looking at what a CCBHC coordinated system might look like for Winnebago County. Organizations feel that they could be better incentivized to participate in something like that, and what the coordination features of that need to be. So that will be the focus of the April meeting. And then the promotion and awareness is the third element or the third area of the strategic plan. And we do a public participation survey out for residents for that. And we have the results of that as well integrated into the presentation for May. And then we will be discussing recommendations there. So this is a way to, because we're a little better organized and prepared and a little more skilled at doing this now, we have the ability to tease this out over a few meetings rather than doing that really long 4-hour meeting, if anybody remembers. You kind of, by the end of it, are just like, whatever. So hopefully this will be a little more engaging. So we'll just get started. I think Alex is going to get us started with kind of the overview of what this section is, and then I'll show you the results of the environmental scan, and then we can get into kind of some feedback on specific areas.
So, programming. The purpose of the programming goal is to support the functions of the Winnebago County Community Mental Health Board, as well as the larger community of mental health and substance abuse system of care in Winnebago County. We do this through 4 main objectives: targeting and filling gaps in the community support system, funding mental health and substance abuse programs in Winnebago County, assisting Winnebago County Community Mental Health Board funded programs, and evaluating both internal and external systems of mental health care. So strategy A for objective 1.1, targeting and filling gaps, is conduct community research that encompasses both lived and professional experience. The measure of success that is associated with this strategy is annual evaluation of Winnebago County mental health and substance use gaps and strengths. The recommended update I have for this going into the next cycle is just evaluation of Winnebago County mental health and substance use gaps and strengths conducted in alignment with the strategic plan. We're on 3-year grant cycles now. Examples of us achieving this goal would be the Guidehouse report. We updated the sequential intercept model in program year 4 at an LNC. We have conducted the environmental scan and public participation survey, and we've also did key informant interviews this round. Strategy B for objective 1.1 is identifying population and service needs lacking in measure of success is the same as the strategy before, annual evaluation of Winnebago County mental health and substance use gaps and strengths. My recommended update is the same, where it's just evaluation of Winnebago County mental health and substance use gaps and strengths conducted in alignment with the strategic planning process. Examples of us achieving this would be site visits. At site visits, we discuss barriers and challenges on the client and the staff side. The Guidehouse report is another good one. And then we've also done the public participation interviews and the environmental scan. Speaking of the environmental scan.
Thank you. So again, this is also the 3rd iteration we've done of the environmental scan. Actually, I think that Mr. Kunert was the original author of it, and we've of course tweaked it a little over the years, but we've tried to keep it relatively similar because we want to make sure that we have and basically what this is looking at the different elements of the community support system, and then kind of surveying direct service agencies in terms of what some of the strengths or potential service gaps are in each of those components. We have had each iteration of this, approximately 50 agencies. In this iteration, we had 50 agencies. You can see over time the different types of organizations that have filled this out. Nonprofits being the largest in number, followed by private practice. So it's not just the organizations that are funded from the mental health board. It's really a look at the community services for mental health and substance use at large, and then public sector being the 3rd largest category. This is kind of the breakdown of services over those components of the community support system. The traditional kind of clinical elements of mental health treatment being the highest, particularly in supportive counseling, with over 60% of agencies providing that service. Client identification, outreach, and family and community support are also on the higher end, and the lower end you will see housing and income supports. Some of the changes that we saw in aggregate this is not just for the repeat respondents as well, but in aggregate, we saw that there's been a large increase in agencies providing supportive housing. We saw that almost double in the percentage of organizations this out. Medication management services went up, and also substance use services. That was also true for those that were repeat respondents. So even if you're only comparing those that filled it out in environmental scan 2 and 3, we saw all 3 of those service areas go up, meaning more organizations providing those services. We saw a reduction in client-operated services, which I don't have a good explanation for that, except I think that maybe it's a legacy term that's not, maybe wasn't fully understood or communicated well in the environmental scan too, because as I look at some of the organizations, I don't know, other than maybe the federally qualified health centers that have requirements regarding clients being on their board. I don't know that there are truly client operators. That might be a point of clarification with some of the organizations, because I don't otherwise have a good explanation for what client-operated services went away. I don't think that's actually the case. In general, we're seeing around the median was about 5 services per person. You see a peak at 2 to 3 services, but then you also see some one organization that provides 20. So it's probably almost all the elements of the community support system. So a lot of variety, but average is about 5, and a little skewing on the high end for those that provide much more. When we're looking at kind of target populations and ages that are being served, we do see that young adults, 19 to 25, is the highest percentage. And again, I think we've seen that similar statistic in all iterations of this, and it's not surprising because the research does show that that is the most likely age group for the onset of serious mental illness symptoms. And when oftentimes the episodic episode or crisis might take place in somebody that is developing serious mental illness, that then is followed by adults, which also adults in aggregate is going to be a larger proportion of the population than youth. So again, that's not surprising either. And then we see older adults, adolescents, and children. And on the far end, infant and early childhood has been a less developed area of mental health traditionally, and we're seeing lower service percentages there. And then specific clientele is capturing those really niche programs that are really targeting like veterans only or something like that. When we're looking at volume, that's kind of important, I think, even as the board was considering whether or not to do grassroots funding and making decisions. We see there is a large variety of volume types. So organizations that are high volume, 300 or plus clients is about half of the total service delivery. And then we see a lot of variety below that. All the way down to organizations that are providing services to less than 50 clients per year. That's still a significant proportion of the service delivery system. And then when we're looking at funding, this actually is one that we see a significant change in, because in environmental scan 2, the mental health board grants accounted for about, I shouldn't say, that's the wrong way to frame it. I should say 48% of those organizations received mental health board funding, and we're seeing that had gone up to now 70% in this cycle. And the state of Illinois grants, being what was the highest in the last iteration, is now second and stable around 50%. We also see that local philanthropy has gone up in its support for mental health. So I think it's pretty fair to say that local funding is a critical element of the mental health services in Winnebago County. How that local funding impacts the ability to provide services to people who are otherwise unable to afford it. We do see that agencies that provide fee for service and also have a sliding scale, we see that that percentage is higher for those that have mental health board grants. So we do know that I think there's a direct connection between that local funding and providing affordable services as well. This is another improvement that is good for the community, and that we saw language support services go up from the last survey from 62% in aggregate to 79% of services that are now being provided in other language and languages beyond English. 26% of agencies have language line services, which would be like a phone translation, maybe in a number of languages. But the other encouraging factor here is that it's not only Spanish as the secondary language service that's being provided, but also Arabic and Swahili at almost 20% for both of those languages of agencies that are providing support for those languages or people speaking those languages. And for repeat respondents, we did not see any change. Any significant change, at least. Wait times, I know, is always a critical evaluation component of if the work that the board is doing is really actually being effective. Are we seeing the wait times go down? And we have in a lot of areas. So in diagnostic evaluation, supportive counseling, we've seen 40% reductions in wait times, and substance use, 0.5% reduction in wait times. And we're seeing wait agencies that have current wait times in those areas ranging now between 8 and 16%. Supportive housing was a new question on this survey, so we don't have a comparison to the environmental scan 2, but we do see that it's about 50-50 for the 10 agencies that provide that service. So we are still seeing more significant wait times for supportive housing than some of the next. Just looking at where services are provided, we do see that main office or alternate office location is still the highest area of service delivery, but then virtual is not far behind it. A lot of agencies providing virtual services, and then a large variety of mobile services as well, from a third of agencies providing services directly at a client's residence to a number of like homeless shelters, police or jail, and educational institutions and schools. And then also something that we take a look at every time is how services are being provided through the lens of dual diagnosis or co-occurring disorders. And we see that, more than half of the agencies are providing services for dual diagnosis. We see a little bit more on the mental health side than the substance use side, where it's for mental illness only rather than co-occurring or dual diagnostic. So it'll be interesting to see how that landscape shifts as well now that the state of Illinois has merged its two departments of mental health and substance use into one unit. So I think they're looking at probably iteming will take a more integrated approach moving forward as well. History is always repeating itself. And with that, that's kind of the landscape overview of services. And then we just want to go through now through that lens, kind of revisit some of the strategic plan objectives and get your feedback and make a few recommendations for the next plan.
Alrighty, so objective 1.2 is funding, and the strategy A is mental health board members review and evaluate submitted and completed grant applications. The measure of success that is associated with this is at least 3 board members review and score grant applications to strategically fill identified gaps. Examples of this include the last round of core funding, the program year 5 through 6 renewal funding evaluations, all of the accelerator award evaluations, and the grassroots evaluations. All of the letters of interest and applications had at least 3 reviewers. Strategy B for objective 1.2 is mental health board members vote and approve funding as decisions to organizations. There's no measure of success directly connected to the strategy, so the recommended update is just some contextual NA is done in person at board meetings. The examples for this would be the resolutions approving core funding, accelerator awards, and now the grassroots funding. Strategy C for objective 1.2 is review and evaluate monthly financial submissions from funded organizations consistent with an expenditure-based funding policy. Recommended update for strategy C is review and evaluate monthly financial submissions from funded organizations consistent with their contract. This is to account for accelerator awards, which are deliverables based. The measure of success there was no measure of success directly connected to the strategy. So the recommended update is that it's a part of administrative operations and you guys as the board get quarterly finance updates. Examples of this include the core and grassroots funding for reimbursement submissions. It goes from our accounting associate to the director of finance to director of community impact to mental health board treasurer, then to the county. For accelerator awards, it goes from me, the grant manager, to director of community impact, to mental health board treasurer, to the county. Objective 1.3 is grant management, and strategy A is create a multi-tiered system of support and accountability for the measures of success for this strategy. There were 3 of them. First one was increase the percentage of programs who successfully complete all intended outcomes for the program year. Second one is all agencies report on the progress of their intended outcomes. And third one is 100% of agencies have been assessed and assigned a tiered level of support and accountability. Examples of this include all core programs are required to submit the quarterly outcomes. The data dashboard is public facing and free at your guys' leisure. And then me as grant manager gives additional supports as needed. My recommended update for this strategy is just to make it a little bit more general and just say hold all funded programs accountable to their contractual requirements, additional support given as needed. The measures of success would stay relatively the same, except for the first one, it would be increase or maintain the percentage of programs who successfully complete all intended outcomes for a program year. And then the last one where all agencies are held accountable and are given needed supports. Strategy B for objective 1.3 is maintain a learning network collaborative encompassing leadership of funded programs to increase community knowledge and sharing of resources. There is not a measure of success that directly ties to this strategy. So I'm just recommending a little contextual LNCs are held equally in requirements for funded programs. We've had a bunch of past topics, including updating the sequential intercept model in a program year 4 LNC. We had Kaizen Health on board all of the organizations for the HIPAA compliant rideshare at the end of program year 4. We had the IRIS and the Youth Mental Health System of Care team present in August. We had some housing programs present in November. And then the topic for the last LNC in February was infant and early childhood mental. Strategy C for objective 1.3 is attend annual site visits to observe funded programs and discuss programming. My recommended update for strategy C is attend site visits to observe funded programs and discuss programming as necessary for compliance monitoring. The measure of success that connects back to the strategy is 100% of organizations participate in a site visit. Update is all agencies participate as requested. Examples of this include the program year 5 through 6 renewal site visits, program year core site visits, 4 site visits, the program year 5 site visits that are currently going on, the accelerator award site visits, and then grassroots funding awardee site visits, which will happen next program year. Objective 1.4 is evaluation, and strategy A is collect target populations and measurable outcomes. The measure of successes for these are all agencies report on the progress of their intended outcomes, and 100% of organizations utilize previous program year performance data to inform future programming. I have no updates for this strategy, but examples of us achieving this would be core programs are required to submit their outcomes quarterly, and this is also shown best through the data dashboard. Strategy B is measure the efficacy and impact of individual funded programs. The measure of success connected to this is all renewal program funding is based on past evaluation data. I have no updates for this strategy, and the examples of us achieving this strategy would be percent utilization of budgets are tracked monthly, all financial submissions go through a vetting process. Once again, it's all on the data dashboard, and then you guys as board members receive report cards at the program year 5 through 6 renewals took past evaluation data into account. Strategy C is determine the efficacy of individual programs have on overall change within the community support system. My recommended strategy C is determine the efficacy of individual programs have on overall change within community systems. This makes it a little bit more general. The measure of success, 100% of organizations utilize previous program year performance data to inform future programming. Examples of this include the program year 5 through 6 renewals, the report cards, the future program year 7 through 9 grant cycle, and then future external consultancies. In short, these are the formatting updates for Goal 1 programming. This is from the current strategic plan. And then this is the update. So each strategy is aligned with a measure of success. As you know, these are the program year 4 through 6 strategies. And these are the recommended program year 7 through 9 strategies. What's underlined are the changes. As you know, these are the program year 4 through 6 measures of successes. And these are the recommended of successes for next. The changes are all underlined. And with that, I'll turn it back to Jason.
So a lot of information, not expecting you to necessarily have to provide all of your feedback right now. You can provide feedback right now if you'd like. You are also welcome to send us feedback or deliver that when you have more chance to review this. We'll send the slides out to everybody to look at it. The draft strategic plan will be ready for the June meeting, and you'll have an opportunity to review the whole thing at that point in time. Just don't want to drop it all on you at once. So feel free to provide that feedback however you'd like, and then there'll be a public comment period after that. So it won't even be finalized necessarily at that meeting. But if there are questions or things that you want to communicate today, the other thing that we wanted to get your feedback on are if there are gaps that should be specifically highlighted as still existing in the community. Dr. Gorski?
Yeah, Jason, particularly as it relates to gaps. And we've had this discussion, it seems like here in past years about being reactive versus proactive. So unless I'm missing the boat here, it seems like we're still largely reactive with respect to the identification of gaps during the data of what funded programs are doing. If gaps are identified, we're relying on agencies to come forward to fill those gaps, which then might receive preferential review by the board members relative to funding, if that's an accurate characterization.
That is how all of the funding cycles thus far have been, correct?
And I'm saying in years past, I mean, even you and I have had this conversation, do we ever become an organization which is more proactive, where given the breadth of the environment that we're working in, is apparent here in this body. We see things for which there are no organizations coming forward to fill that gap. And I don't know if anywhere for similar organizations and boards like ours, are there any models where then we would go out and seek organizations or collaborative organizations that could fill a gap rather than waiting for them to come to us?
Yeah, I think there are some models out there. I think if I could just reflect on what was called out in the last one, because there's a good example of where the gap wasn't met. There were 7 gaps identified that were identified specifically in the program year 3 notice of funding opportunity, and then again in the program year 4 notice of funding opportunity. I think we received proposals that addressed 6 of those. I do not recall any proposals that address disordered eating or eating disorder treatment. So that would be a good example of an area that being called out numerous times has not been addressed. I think if the board wanted a more proactive approach on that particular gap or a gap like that, you could develop a targeted notice of funding opportunity specifically for that and convene organizations to discuss what the barriers are to even writing a proposal for something like that. That would be one way. We could look at other models, but I think that's the general way to get more targeted and more specific.
I wonder if it's a natural course of our evolution to begin thinking of that. And eating disorder would be one, but there may be others that, again, once you all see the breadth of everything that's out there, you go, well, there's that, but there's these other things that, so maybe it's that's brought forward to us as a concept for future activity, that we've identified 3 areas that it's being incompletely addressed. There's still gaps, or it's not being addressed at all.
Yeah. Thank you. No, it would be good to include that in the strategic plan. So it's a good time to bring that back to attention. Appreciate that. Any other feedback?
Answer, pardon me. I was hoping that when you have the grantees, that those sorts of issues would come up, that gaps could be talked about or seen, and that agencies themselves would start to, say, we would like to do this.
Mm-hmm.
We had that years ago in the homeless task force.
Yeah.
That was one of the ways that the gaps were filled. Do you see that coming about, Jason?
I don't think we've done that for the primary reason that I don't want to circumvent the board's funding process. And so if we start getting in that conversation in that container, and the answer is, yeah, we'll do that. Where's the money for it? So we do talk about coordination of services in that, but I don't think we're talking about that. And maybe that is part of the solution. And maybe you need to think more creatively about how to do that and still have the appropriate boundaries around funding. So I'm open to that as well. I think that's a good point, that that's already a container where convening is happening. But that's probably the main reason why I hesitate to do that.
Okay. Appreciate that.
Being honest about that, yeah. Any other feedback can come to us. We have months ahead to be working on this, but anything else that any board members wanted to express today or have questions about as it relates to the process?
Thank you for what you've done.
Okay. Right. Thank you.
Okay. Okay. So any matters that we needed to discuss this afternoon? Terry?
I was invited to a gathering last week called the One House Club. Are you familiar with that, gentlemen? And I think you're with that? Okay. So it's a club that's, and there's an organization that's finally stubborn from downstate, trying to bring Jack around here. dealing with, police and fire, first responders, people through a traumatic experience. I'm sure, Deputy Chief Lexi, you can probably attest to the fact how many paramedics you lose within a matter of a few years. It was rather interesting thing that they were talking about, and I've been invited to their Monday and listen to police and fire, these speakers talk about what it's like for them, how it's sort of treating their families, treating their lives, how it's not enough mental health workers out there to work with them. So they want to read a chapter out here, and I hope that we as a community will embrace that. I think it's long overdue. Those looks like Jeff, but they always should be here. Yeah, it's real interesting that it's something that I only see here as well. But police and fire deal with every day. How supports they don't get because well, so I would hope you do have this check right here if you want to read all these up here. It's called so it's interesting. Police and fire.
Okay. And incidentally, I meant to also compliment everybody for what you did with the grassroots program in terms of doing the reviews. That took us some time for everybody's time to do that. So thank you all very much. That was a task. Okay. All right. Hearing no other, yes, Jeff. Okay, all right.
No executive.
Okay. So then I would entertain a motion for adjournment. Okay, so moved. Second, there's a second. All right, all in favor? We've done it. Okay.